Can an irregular heartbeat really cause a stroke? The answer is yes, and it happens far more often than most people realize. In fact, one common heart rhythm problem can increase your stroke risk by up to 5 times. But here's the part many people misunderstand. Not everyone with atrial fibrillation has the same risk. Some people may live for years without a stroke. Others may have one as the very first sign something is wrong. So what actually determines your risk? In today's video, we're going to break down exactly how atrial fibrillation leads to stroke, what factors increase that risk, and most importantly, what you can do to protect yourself. If you're new here, welcome. I'm a stroke doctor in the UK, and this is information every person with an irregular heartbeat should understand. Before we get to the stroke connection, let's quickly cover what's happening in your chest. Your heart has a natural pacemaker, a tiny spot in the top right chamber called the sinoatrial node. Think of it as the conductor of an orchestra, sending out a regular, organized electrical signal to keep your heart beating in perfect rhythm. This normal rhythm, usually between 60 and 100 beats per minute when you're resting, lets your heart pump blood efficiently through your body. Now imagine the conductor walks off stage, and a bunch of amateurs all try to lead the orchestra at once. It would be chaos. That's atrial fibrillation. Instead of one clear signal, chaotic electrical impulses fire from all over the heart's upper chambers, the atria. They can fire 300 to 600 times a minute. The atria can't squeeze that fast. So instead of a strong, coordinated contraction, they just quiver or fibrillate. This electrical storm causes a few problems. The lower chambers, the powerful ventricles that pump blood to your body, are getting a flood of confusing signals. They try to keep up, but their response is fast and, most importantly, irregular. This is the racing, erratic pulse that people with AFib often feel. And it's incredibly common. It's estimated that by 2030, over 12 million people in the US will have AFib, with projections continuing to rise. Worldwide, that number is already in the tens of millions. One of the trickiest things about AFib is that it can be completely silent. Some people feel palpitations, shortness of breath, fatigue, or dizziness, but many others have no symptoms at all. They are totally unaware their heart is beating out of rhythm. This is what makes AFib so dangerous. The absence of symptoms does not mean the absence of risk. A person can feel perfectly fine while the chaotic rhythm inside their chest is quietly setting the stage for a devastating event. So how does a heart rhythm problem cause a brain problem? The connection is mechanical, direct, and unfortunately, very effective. Picture a smoothly flowing river. The water moves along, carrying everything with it. Now, imagine part of that river widens into a calm, stagnant pool off to the side. What happens there? Leaves and debris settle and clump together. Your heart in AFib creates a similar situation. With a normal heartbeat, the atria contract fully, pushing all the blood down into the ventricles. But in AFib, the atria are just quivering. They aren't squeezing effectively. Because of this, some blood gets left behind and starts to pool, especially in a small, ear-shaped pouch on the left atrium called the left atrial appendage, LAA. This is where the real danger starts. When blood doesn't move, it's designed to clot. It's a defense mechanism to stop bleeding. But inside the heart, this life-saving feature becomes a life-threatening flaw. The stagnant blood in the LAA begins to form clots, or thrombi. That clot might just sit there for a while, but all it takes is for a piece to break off, get flushed out of the quivering atrium, and shot into the body's main circulation. From there, it's often a short, direct trip up the carotid arteries to the brain. The blood vessels in the brain get progressively smaller, like the branches of a tree. That traveling clot, called an embolus, will journey until it reaches a vessel that is too narrow for it to pass. It gets stuck, forming a plug and blocking all blood flow beyond that point. This is an ischemic stroke. The brain tissue that was fed by that vessel is suddenly starved of oxygen. Within minutes, brain cells begin to die. This is why AFib is such a potent risk factor. It's a clot-forming factory right in the center of your circulatory system. The statistics are stark. AFib is responsible for about 1 in every 7 strokes. And because clots formed in the heart can be larger than clots from other causes, they often block major brain arteries. This can lead to more extensive damage, more severe disability, and a higher mortality rate. While the image of pooling blood is easy to understand, modern research shows the story is even more complex. The link between AFib and stroke isn't just a plumbing problem. There are deeper biological processes that turn the heart into an environment that's perfect for making clots. These processes are rooted in inflammation and oxidative stress. Think of inflammation as your body's response to injury. It's necessary, but when it becomes chronic, it causes damage. In AFib, the heart tissue is under constant stress from the chaotic electrical signals. This triggers a low-grade, persistent inflammation in the walls of the atria. This inflammation makes the inner lining of the heart, the endothelium, stickier and more likely to start forming a clot. At the same time, a process called oxidative stress is happening. This is basically an imbalance between the production of damaging free radicals and your body's ability to neutralize them. The rapidly beating atria are working overtime, generating a surplus of these free radicals. Think of them as tiny vandals damaging the heart cells. This damage not only makes AFib worse, but also helps create what scientists call a prothrombotic state, a condition where the blood is just more likely to clot. So you have a perfect storm. First, you have blood that isn't moving, stasis. Second, you have inflammation making the heart's lining sticky. And third, you have oxidative stress activating the very components needed to build a clot. It's this three-pronged attack that makes AFib such a powerful driver of stroke risk. It shows that AFib isn't just a rhythm issue. It's a condition that changes the very biology of your heart and blood. We've established that AFib increases stroke risk. But here's the key. The risk isn't the same for everyone. A 50-year-old with AFib and no other health issues has a very different risk profile than an 80-year-old with diabetes and high blood pressure. So how do doctors figure out your personal risk? They use a powerful and elegantly simple tool. It's a checklist called the CHADS-2-VASc score. It sounds complicated, but it's just an acronym for the most important stroke risk factors in people with AFib. Let's quickly walk through it because understanding this score is the first step to being an active partner in your own healthcare. C is for congestive heart failure. If your heart muscle is weak, that's 1 point. H is for hypertension. A history of high blood pressure gets you 1 point. A2 stands for age greater or equal to 75. Age is a huge factor. If you're 75 or older, you get 2 points. D is for diabetes. If you have diabetes, that's 1 point. S2 represents a previous stroke or mini-stroke, TIA. Because having one clot makes another more likely, this is the strongest predictor and gets you 2 points. V is for vascular disease. A history of a heart attack or blockages in other arteries adds 1 point. A, the second one, is for age 65 to 74. This age group gets 1 point. SC stands for sex category. Research shows that being female can add to the risk, so if you are a woman, you get 1 point. A doctor totals up the points to a maximum of 9. This final number isn't arbitrary. It translates to a specific percentage risk of having a stroke over the next year. For example, a score of 0 for a man means a very low annual risk, while a score of 5 corresponds to an annual risk of around 6 to 7%. This score is the cornerstone of AFib management. It's what helps your doctor decide if you need the most critical intervention, a blood thinner. The CHADS-2-VASc score is an incredibly useful tool, but it's also led to a dangerous myth, the idea that a low score means you don't have to worry. That is fundamentally untrue. Let's be perfectly clear. A low CHADS-2-VASc score does not mean you have zero risk. It means your risk is lower than someone with a high score, but it is still higher than someone with your same health profile who doesn't have AFib. The research is clear on this. Studies have shown that AFib itself is an independent risk factor for stroke, even if you don't have any other conditions on the checklist. Think of it this way. The CHADS-2-VASc score isn't a tool to determine if you have a risk. Having AFib already establishes that. The score is a tool to quantify how high that risk is and to guide treatment, mainly whether you need a blood thinner. In practice, a man with a score of 0 or a woman with a score of 1 might not be immediately started on a blood thinner. This is because at that very low annual risk, the small but real risk of bleeding from the medication might outweigh the benefit. However, as soon as the score goes up to a 1 for a man or a 2 for a woman, the math changes. At that point, the risk of an AFib-related stroke usually starts to outweigh the risk of the medication, and a blood thinner is typically recommended. The biggest mistake you can make is to see a low score and think, "I'm safe." That's a false sense of security. Your risk factors aren't set in stone. You get older every year, and your health can change. Your CHADS-2 VASC score needs to be a living conversation with your doctor, not a one-time calculation. Understanding the risk is the first half of the battle. The second, more empowering half, is knowing this risk is highly manageable. The main goal in treating AFib isn't always to get rid of the arrhythmia, but to eliminate the stroke risk that comes with it. For that, modern medicine has a very effective solution: anticoagulants. Commonly known as blood thinners, these drugs don't actually thin your blood. They work by interfering with the clotting process, making it much harder for those dangerous clots to form in the first place. Studies show they can reduce the risk of stroke in AFib patients by about 2/3 or even more. For decades, the main blood thinner was warfarin. It's effective but requires frequent blood tests and has many interactions with food and other drugs. In the last 15 years, however, a newer class of drugs called direct oral anticoagulants, or DOACs, has revolutionized care. Medications like apixaban and rivaroxaban are just as effective, if not more so, than warfarin, but are far easier to manage, with no routine blood tests and fewer interactions. Now, many patients hear blood thinner and get nervous about bleeding. It's a valid concern, and your doctor will balance it with your stroke risk. But for the vast majority of patients with a CHADS-2 VASC score of 2 or more, the risk of a debilitating or fatal stroke from AFib is much, much greater than the risk of a serious bleed from the medication. But what if you truly can't take blood thinners? For a small group of patients, there's a remarkable alternative: left atrial appendage closure. Since most clots form in that little pouch, the LAA, the idea is to seal it off. This is usually done with a minimally invasive procedure using a device like the Watchman. A cardiologist guides a small, parachute-like implant through a vein in your leg up to the heart, where it's deployed to permanently close off the LAA. For the right person, this one-time procedure can provide a lifetime of stroke protection without blood thinners. While medications and procedures are the most powerful tools we have, they aren't the only ones. Your daily choices play a huge role in managing your risk. Adopting a heart-healthy lifestyle isn't just a vague suggestion. It directly impacts the risk factors that make up your CHADS-VASC score. Let's look at hypertension, the H in the score. Controlling your blood pressure with diet, exercise, and medication is one of the best things you can do. The same goes for diabetes, the D. Keeping your blood sugar in check is a direct form of stroke prevention. Weight management is also critical. Obesity is a major trigger for AFib episodes. Even modest weight loss can have a profound impact on reducing your AFib burden and strain on your heart. And it's especially important to limit or avoid alcohol. Excess alcohol is a well-known trigger for AFib episodes, sometimes called holiday heart syndrome. Cutting back can directly reduce the amount of time your heart spends in that dangerous rhythm. Finally, if you smoke, quitting is one of the most powerful changes you can make. Smoking damages blood vessels and makes blood more likely to clot, adding another layer of risk. These lifestyle changes work hand in hand with your medical treatments. They empower you to take an active role. You can't change your age, but you have a significant degree of control over these other factors. Every healthy choice is a step you're taking to protect your brain. We've covered a lot, from the electrical chaos in the heart to the specific tools doctors use to protect you. But the single most important takeaway is this: you have to take action. That flutter you felt is a signal, and it deserves to be investigated. Your first and most critical step is to talk to your doctor. Don't dismiss your symptoms. Don't wait. Make an appointment and be specific about what you're feeling. Before you go, write down your questions. Ask them directly. Could this be atrial fibrillation? And what is my personal risk for stroke? You can even bring up the CHADS-2 VASC score. It shows you're an engaged partner in your own health. Remember, AFib can be silent, so even if you feel fine, it's vital to discuss your risk, especially as you get older. That flutter in your chest is a question your body is asking. Today, you've gained the knowledge to understand the answer. We've learned that atrial fibrillation isn't just a harmless skip. It's a condition that creates a perfect storm for clots, dramatically increasing the risk of a severe stroke. But we've also learned that this risk is not your destiny. It's a measurable danger that can be assessed with the CHADS-2 VASC score, turning a vague fear into a concrete action plan. We've busted the dangerous myth that low risk means no risk, because AFib itself is always a factor to be respected. Most importantly, the threat of an AFib-related stroke is highly preventable through modern medications that are safer and easier than ever, through amazing procedures that can seal off the source of clots, And through powerful lifestyle choices that are in your hands, you can take control of your health. The journey from a worrisome flutter to a protected future begins with a conversation. Take what you've learned today and talk to your doctor. It's the most important step you can take to ensure an irregular heartbeat doesn't lead to a life-altering event. Your heart and your brain will thank you for it.